Medical Director here at Stanton Territorial Health Authority. Stanton Territorial Hospital is essentially the secondary care hospital for all of the Northwest Territories and for the western part of Nunavut, so that what we call the Kitikmeot region. This is an area that encompasses about a quarter of the geographic size of Canada. So extends from 60 degrees south latitude, which I know most people in Alberta probably think is north, but for us, that's our far southern reach. And then our northern reach goes all the way up to the North Pole, and there are very few people up there, so we don't have to use medivacs in that area. But we do have people way up in the high latitudes, 75, 78 degrees north, so we're talking a long way up. The delivery of healthcare and the delivery of any kind of services in the north is a challenge, not only the geographic challenge, but the climate challenge. Many of these areas do not have road access, which people get a concept of, but what people don't realize is many of these areas do not even have what we call landline access. So for a telephone pole or utility poles to bring power in across the grid, you see these huge grids down in Alberta when you're driving. These places are so remote they do not even have that. So it's amazing that they function. The people that are there have been there for thousands of years. They know how to do it. And it's, they're tough. But it's also tough providing health care and services to these remote communities. And ultimately, in some severe cases, you have to route some of these people from the far reaches of the high Arctic as far away as Edmonton for the appropriate care. Yes, we try to do, our philosophy here is try to get everything done as close to the person's place of residence as we can, but as long as it's safe, as Ms. Lewis was mentioning, and if we can handle it. But if we don't feel we can handle it, then they keep coming progressively further. Each one of these areas will have a kind of an initial hub. The people from up in Sax Harbor will have an initial hub up in the Inuvik region. And then there's a secondary hub, which would be here to Yellowknife. And once people have made it through that, if we can't handle it, they do have to go down to Edmonton, who provides us excellent tertiary care services through the Alberta Health Services there. When you heard about the closure of the Edmonton City Centre Airport, what were your thoughts? When I first heard about that, I thought, what are going to be the ramifications for us? You know, and then I was trying to think, okay, how are they going to get people through to our tertiary care providers, which are essentially the University Hospital, the Stollery Hospital, as well as the Royal Alex. We have maintained excellent relationships with those people there over the years, and they give us fantastic service. And so my thoughts were, what effect is this going to have? Is it going to be like a 2-hour delay, a 5-minute delay, a 10-minute delay, or what the delay is? To actually live in this environment that we have to get these services to them, we're talking the distance of probably, say we would take somebody from Sax Harbor, I'd have to look at the map, but we're talking a distance of probably around 2,000 kilometers, if not more, to get a person from there all the way down to to Edmonton. Now, that kind of time frame, when number one, we have to mobilize your initial transport from Inuvik to get to Sax Harbor, then from Sax Harbor to Yellowknife, we've already used up the fuel capacity on that plane, as well as we've taken that plane out of its home base. So we need 2 planes to transport that person down. So another plane has to be either organized here at Stanton or to come up from Edmonton to facilitate the transfer. So we're talking, this is 5-6 hours that we're talking about to get somebody from up there down to the Edmonton, whether it's the municipal airport or the international airport. When we're at it, looking at another 15 minutes or 20 minutes on top of 5 hours, that's a relatively small percent. If you're looking at another 5 minutes or 25 minutes on top of 10 minutes, that's a huge percentage. So for coming from way up, so our philosophy then is we've got to deal with these people before they get to Edmonton. These are time critical conditions, and a lot of that. Our personnel that are on these airplanes, the medevac personnel, absolutely fantastic. They provide you know, excellent service. They're very highly qualified, and we try to get that services to the people as quickly as we can. The nurses in these communities, I mean, the broad spectrum of disease that they have to treat, as well as acute diseases, unbelievable. The nurses out in these communities, you know, really what they do, I think, is a real story for you guys to get out and talk to them, the whole spectrum of their job. To the people of Alberta, I mean, we thank them for their support for us, you know, as well as certainly the healthcare providers down there. They should get up and see Yellowknife if they really want to see what's going on. They'll find it to perhaps be quite surprised if they actually get up here.